Hello, my name is Nicolas Larraín, and I will be giving a short overview of my last 3 years as a PhD student. My research is related to the performance assessment of integrated healthcare systems, so we have to start by understanding what is an integrated healthcare system. Integrated care is the approach to healthcare that seeks to overcome care fragmentation by linkage and coordination of providers' services along the continuum of care. These systems are characterized by their focus on investment in prevention and health intelligence, improving system efficiency, quality of life, and avoiding unnecessary costs. Because of the unique nature of integrated systems, researchers encounter challenges when assessing their performance. The chapters of my dissertation, corresponding to the papers I work on during my PhD, relate to understanding and dealing with 4 of these challenges. The first relates to the fact that taking care of patient needs as a system instead of fragmented providers affects stakeholders' accountability and interferes with the tracking of causality between the system actions and its performance. We consider simulation models as a good complement to assess integrated care, given their capacity to include system complexity, and so we perform a literature review to understand and characterize their potential. Our main finding is a unified framework to understand complexity across 5 simulation modeling techniques, with 9 dimensions that are enabled differently across techniques. This framework can be used to identify and prioritize the complexities of the system that needs modeling, and while doing so, it guides researchers into the modeling technique that is most appropriate. The second chapter and paper of my PhD is directed to measuring the effects of integrated care over population health outcomes, and by doing so, identifying the evaluation design that fits better to integrated care. We performed 2 quasi-experiments comparing around 10,000 participants of an integrated system to an equivalent control group of patients in the same region and followed them up for 5 years. The first design, based on propensity score matching, showed positive and significant results in all the population health indicators that we studied. However, the design couldn't find matches for part of the sample that was systematically sicker and older. This is especially harmful to integrated systems. The population approach implicates having interventions and specialized care for all patients. Hence, a systematic exclusion of part of the patient spectrum will bias the evaluation results. Our second design was based on entropy balancing and produced positive and significant results for 2 population health indicators, mortality and hazard ratio. The design has the advantage of producing comparable groups while not excluding any treatment sample. For this reason, entropy balancing is better suited to deal with the population approach of integrated care. The third chapter and paper relates to assessing physician cooperation, an important value-creating mechanism of integrated care that is currently overlooked because of the difficulty in creating indicators and designs to measure it. We used social network analysis to create the cooperation network based on shared patients of a region in the south of Germany for 14 years using claims data, and investigated the evolution of cooperation by tracking network characteristics at the network level and also at the node level with a dynamic panel analysis with fixed effects. The indicators derived from the network properties allow us to evidence a positive evolution of physician cooperation in the region. Further, by comparing physician practices that participated in a local integrated network against other practices in the region, we proved that participating practices led to positive evolution by systematically improving their cooperation more than the non-participating practices. The last chapter of my PhD relates to studying the lack of a clear guideline to develop a successful data strategy, an area of high relevance to integrated systems performance assessment, as the use of data to inform actions and interventions is a key element in the approach's value-creating mechanism. We approach this topic by studying 4 leading organizations managing integrated systems and use semi-structured interviews together with published and unpublished documents to determine what are the key levers of a data strategy in 7 dimensions defined in literature. This case series is helpful for healthcare managers when they are defining their data strategy. Furthermore, it is also helpful for researchers assessing the performance of integrated systems as it provides guidance on the topics and dimensions that are important to include in the assessment. That completes my quick overview, and I hope you enjoyed it.